Hello, everyone, and welcome to our question lab. This evening's topic is fungi and parasites, and we're happy to have all of you here. My name is Sean. I've been with Scholar RX, specifically with RX Coach, for a little over 2 years, working with students individually to help them accomplish their academic goals. But leading tonight's session is actually Paros Vicaria, and he's going to introduce himself now.
Thank you, Sean. Hey guys, my name is Paris. I'm a dermatology resident at UT Southwestern here in Dallas, Texas. Originally graduated from pharmacy school in St. Louis, Missouri. Then went back home to Michigan to do medical school, and now doing my residency. I have worked with USMLE-Rx as an RX coach, working one-on-one with students to help prepare them for the USMLE Step 1 and the Step 2 CK as well. And I'm happy to help lead tonight's session tonight.
I know I mentioned RX Coach earlier. RX Coach is our coaching and tutoring program. We've worked with hundreds of students to help them accomplish their goals, and we've had some really, really great results. We'll talk about that later this evening, but in the meantime, what you should know is that the process we'll be using this evening is the same process and methodology that we use in RX Coach. So let's go ahead and start with our first question of the evening. As you can see, the answer choices are covered up. And we do that because we don't want you to see the answer choices in advance and become prejudiced or have that guide your thought process, or see an answer choice that you're unfamiliar with, which may cause you to panic as you're trying to answer the question. So we've gone ahead and covered those up for you. After that, we will read the lead-in. The lead-in is the last sentence of the question itself. And the reason we do that is because by knowing what the test writer is asking prior to reading the vignette, you can actually go ahead and pick up on all of those relevant clues and prevent yourself from having to reread that question and waste time on test day. So with that being said, let's go ahead and start with the lead-in. Which of the following is most likely to be seen on biopsy? Which of the following is most likely to be seen on biopsy? So after that, we'd like to ask our students how many steps they think the question will require. And the reason we do that is because by having an organized thought process, you make sure that you're not missing any steps and that you're staying on track and you actually answer the right question. So I'll give all of you a few seconds here to enter in the question box and let us know how many steps you think this question will require. All right, I see one response so far. We'll give all of you a few more seconds. An example of a one-step question could be when they ask you for the diagnosis. An example of a two-step question could be where they ask you, what is the treatment for a diagnosis? And an example of a three-step question is when they ask you what is the mechanism of action for a treatment for a diagnosis. So with that in mind, we'll go ahead and move on now and read the vignette. A 43-year-old man presents to the clinic with flu-like symptoms, low-grade fever, cough productive of purulent sputum, and malaise. He also reports chest pain. The patient recently returned from a hiking trip in the Great Lakes. He has no significant medical history. On physical examination, verrucous lesions with irregular borders are seen on his right forearm. Radiography of the right forearm shows a well-circumscribed osteolytic lesion. Biopsies are taken from the lesion margins. Which of the following is most likely to be seen on biopsy? So I want all of you to start thinking about the important clues in this vignette and in the lead-in as I hand it off to Boris.
Thank you, Sean. So we'll go ahead and show you what we think are the important clues in this vignette and the lead-in. So anytime you have demographics, that's really going to start cluing you in on what's going on, really helping to narrow that differential. This patient's presenting with some important signs and symptoms. Anytime you have purulent sputum or sputum in general, always make note of what type of sputum it is, what other symptoms do they have. They give us some nice social history. This patient went on a hiking trip in the Great Lakes. Why are they telling us that? And then physical exam. We actually have some nice dermatologic correlates there, which we'll talk about. And then we also are given the luxury of having some imaging findings as well. So all of which is going to be important in this question. So now when we take a look at the lead-in, the most important phrases there, really is, they did a biopsy. What are we going to see on biopsy? What's most likely to be seen on biopsy? So when we talk about how many steps this question is, I think one, we need to figure out exactly what's going on in this question. What is the diagnosis? Once we know the diagnosis, what could you maybe see on pathology or biopsy with that diagnosis? So this could be a two-step question depending on how the answer choices are worded. So most likely a two-step question. So let's go ahead and take a look at those answer choices. And what you see here is we have 5 answer choices. And what we're going to do is we're going to start at the bottom and work our way to the top. So I'm going to read them out to you, starting at answer choice E and working our way to the top. And we actually recommend that students do this because a lot of times what we see is that students, they'll start at the top and then they'll see something that they like, they'll select it, and then find out that maybe it's wrong and they didn't get through all the answer choices. So starting it this way really ensures that you don't do that and you don't bias yourself. So we'll go ahead and do that now. Answer choice E, thick-walled yeast producing single buds with a broad attachment base. D, thick-walled spherules filled with endospores. C, strands and spores with spaghetti and meatballs appearance. B, oval yeast cells within macrophages. And A, budding yeast with captain's wheel formation. So we're going to go ahead and open up that poll. Go ahead and select the answer choice that you think is most likely to be seen on biopsy, and we will talk about it in just a few seconds.
Excellent. Thank you so much, Boris. We'll give all of you a few seconds here to respond. I will go ahead and read these answer choices to you one more time because some of them are a little lengthy and got truncated. E, thick-walled yeast producing single buds with a broad attachment base. D, thick-walled spherules filled with endospores. C, strands and spores with spaghetti and meatballs appearance. B, oval yeast cells within macrophages. And A, budding yeast with captain's wheel formation. I see the responses coming in. We'll wait a few more seconds until about 2/3 of you have responded. And then we'll go over the correct and incorrect answer choices. If don't worry, take your best guess. Remember, there's no penalty for guessing on test day. You should never leave a question blank, and certainly not tonight. This is the challenging question, so we'll give all of you a few more seconds. Keep in mind also that all of the responses are completely anonymous. All right, let's see what you selected. And it looks like a clear favorite was E, thick-walled yeast producing single buds with a broad attachment base. So let's go ahead and see what the correct answer is. And the correct answer is, in fact, E, so well done to all of you. If you got it right, let's make sure you got it right for the right reasons. And if you didn't, don't worry. Boris is going to explain it to you now.
Thank you, Sean. Great job, guys. Definitely a nice micro question here. So hopefully you guys got the clue that this was some sort of fungal infection. So what do we have? We have a patient with some sort of pulmonary infection. He's got a cough. He's coughing up purulent sputum, also having maybe some pleuritic chest pain. They further give us some nice information that he's got verrucous lesions on the forearm, okay, and lytic bone lesions. We also know that he's been to the Great Lakes. So on the next slide, Sean has actually gone ahead and pulled up a table that shows some of those systemic fungal infections. And if you look at the very bottom, you can see blastomycosis. One of the endemic locations is the Great Lakes. And the pathologic feature is broad-based budding. So when you look at that picture, you can see that there's essentially two buds that are connected, but it's not via a narrow stalk. It's a nice broad connection, almost like two epithelial cells that are connected to each other. That's called broad-based budding. You can see there under unique signs and symptoms that you can get lung disease, and it also can disseminate to the bone and the skin can have verrucous-like lesions, which may look like squamous cell actually. So as you can see there, a lot of signs and symptoms that our patient had were classically listed in the first aid section on systemic mycoses or fungal infections. So let's go back to our question. And now that we can see that answer choice E is a correct answer, let's talk about what the other answer choices are getting at. So D, hopefully you guys picked up that thick-walled spherules filled with endospores is consistent with cocci or coccidiomycosis. Usually you see that in the southwestern part of the US, and it can cause a pulmonary infection, but you wouldn't see those verrucous lesions and bone lesions like you do with blasto. Answer choice C, whenever you see spaghetti and meatballs, that's really talking about tinea versicolor. And that's more of a dermatophyte infection caused by Malassezia bugs. It's a fungal infection of the skin where you get discoloration, either hypo or hyperpigmented macules of the skin. You don't really get verrucous lesions or bone lesions or pulmonary symptoms. Answer choice B, oval yeast cells within macrophages, that's typical of histoplasmosis. There's two things when you see bugs within macrophages that you really should be thinking of. That's histoplasmosis and leishmaniasis. In this case, with fungal infection, you'd be thinking histo. This can also be seen in the Midwest and can also cause pulmonary disease. However, it wouldn't be as common in this patient who is not immunocompromised, and you also have different types of skin lesions. And lastly, answer choice A. This is getting at that nice buzzword phrase, captain's wheel of paracoccidiomycosis, which is something you see usually in the Latin American countries, not the Midwest of the Great Lakes. So it's important to know these both for step one, all these different presentations, and also clinically. I can tell you in my 1.5 years of dermatology residency, I've seen each and every one of these fungal infections in the skin, and the majority of other residents have in other specialties. So it's important to know this both for step one and also for the rest of your medical career as well.
Excellent. Thank you, Paras. Great job, everyone. Let's go ahead and move on to our second question of the evening. Once again, as you can see, the answer choices have been removed. That is by design. And we will begin by reading the lead-in. Which of the following is the most likely cause of this patient's symptoms? Which of the following is the most likely cause of this patient's symptoms? So we'll give all of you a few seconds here to respond in the question box and let us know how many steps you think this question will require. All right, I see the responses coming in. So let's go ahead and read that vignette. Now, in our tutoring sessions, our tutors will ask you what's the important clue in every sentence, what you're thinking, so that we can identify your knowledge gaps and really get to know you and your thought process. We don't have time to do that with all of you individually today, so I'll pause briefly after every sentence so you can gather your thoughts. A 16-year-old South Asian boy who recently immigrated to the United States comes to the physician because of a sore throat. He has not had a headache, cough, or runny nose. The patient's only medications are an as-needed inhaler for asthma and a new daily medication added 1 month earlier to address worsening symptoms of asthma. His immunization status is unknown. The boy is sexually active with multiple partners and uses condoms consistently. He has used chewing tobacco for the last 2 years, but does not use alcohol or illicit drugs. On evaluation today, his temperature is 99.1 Fahrenheit or 37.3 Celsius. Blood pressure is 121/86, and pulse is 83 per minute, and respiratory rate is 15 per minute. On physical examination, evidence of multiple dental caries is noted. The oropharynx is non-erythematous, but white patches, which can be removed with a tongue blade, are present. No tonsillar exudates are seen. The liver and spleen are not palpable. Which of the following is the most likely cause of this patient's symptoms? So I want all of you to start thinking about the important clues in this vignette as I hand it off to Paras.
Thank you, Sean. So as you can see here, as Sean read through that question, there's a lot of information provided. So it's going to be very important when you start from the beginning and get to the very end that you know what to highlight because when you decide to go back and look at the question, you'll have highlighted the important information. Okay, so that's why highlighting and knowing what to highlight is very important. So again, demographics. This is a pediatric case, a 16-year-old South Asian boy who recently immigrated to the US. So hopefully ideas are already sprouting in your head as to what that could be suggesting. We also have some more signs and symptoms. We're given some information about medications and medication changes, some social history, all important, especially when we're talking about a potential infection. We also are given some important physical exam findings within the oropharynx. And then basically at the very end, they're asking us, what is the cause of this patient's symptoms? So how many steps is this question? I think kind of depends on the answer choices, but I think one, we need to figure out what is the diagnosis here. So one, what's the diagnosis? And two, in this patient, what was the cause of that diagnosis or cause of that disease? So I think maybe a two-step question depending on the answer choices. So let's take a look at those answer choices. And once again, we're going to start at the bottom and we are going to work our way up to the top. Answer choice E, oral hairy leukoplakia. D, lack of immunizations. C, increased intracellular camp. B, HIV infection. And A, decreased transcription of inflammatory cytokines. So we're going to go ahead and open up that poll. Go ahead and select the answer choice that you think is most correct, and we will talk about it in just a few seconds.
Excellent. Thank you, Boris. We'll give all of you a few seconds here to respond. And then we'll go over the correct and incorrect answer choices. Remember, when you're reviewing questions, it's important to review both the correct answers and the incorrect answers to make sure you know why you got it right, if you got it right, and why you got it wrong if you got it wrong, okay? I see the responses coming in. We'll wait a few more seconds here. Keep in mind that we do have a raffle and a special offer at the end of the session tonight. You must be present to win, so make sure you stick around. You could be our lucky winner. All right, just a few more seconds here. And let's take a look and see what all of you selected. And it looks like in first place with 42% of you selecting was answer choice A, decreased transcription of inflammatory cytokines. And let's see what the correct answer is. And the correct answer is in fact A, and 42% of you got it right. So well done to all of you. Let's have Boris explain it to us. Boris.
Thank you, Sean. Yeah, definitely a tough question here. So as you can see here, the most important thing really is the very end of that physical exam finding when it talks about white patches that can be removed with the tongue blade, okay? So that's what you would call scrapable. It's able to be scraped off, and that's consistent with thrush, okay? So why does this patient have thrush? Or oral candidiasis is another way of describing that. Well, there are a lot of different causes of thrush. Immunosuppression. Importantly, however, is the fact that they gave us some important information about medication. So he was on an as-needed inhaler for asthma. So hopefully you guys picked up that that was maybe just albuterol. And then because he was still having worsening symptoms of asthma, he was added on another medication. Now, whenever you're given that many words and clues about something, always make note and think, why are they telling me that? So in this situation, he was probably started on an inhaled corticosteroid, and that probably put this patient at risk for oral candidiasis. As you can see on the next slide, Sean has actually gone ahead and pulled up a table that shows that inhaled corticosteroids and their mechanism of action. They inhibit the synthesis of virtually all cytokines, and it can cause oral thrush. And one of the ways to help prevent that is to either rinse your mouth out afterwards or to use a spacer device with your inhaler. So going back to our question, this patient probably got thrush from the use of inhaled corticosteroids, which work by downregulating or decreasing inflammatory cytokines. Okay, so that's why answer choice A is the best answer in this case. But let's talk about the other answer choices and why those may be incorrect. Answer choice E, oral hairy leukoplakia. That is usually more so on the lateral sides of the tongue and are not scrapable. So oral hairy leukoplakia, think of not scrapable. And that usually is secondary to Epstein-Barr virus. So that's not consistent with this patient. Lack of immunization, answer choice D. We don't know this patient's immunization status, and that could be suggestive of things like measles, mumps, rubella. With measles, you can get types of spots in your mouth called complex spots, but that's a little bit different than this. This is suggesting specifically that scrapable white lesions, which is more suggestive of thrush. Answer choice C, increased intracellular CAMP. That is the mechanism of action beta agonists such as albuterol, but that does not cause oral candidiasis, so that would be an incorrect answer. And then answer choice B, which I think a lot of you guys were thinking as well. HIV is a sexually transmitted disease, infectious disease that can lower your immune system, and patients can develop thrush or oral candidiasis. So that's definitely important to consider whenever you see a patient with thrush. However, there's no other signs and symptoms that really suggest that this patient is developing, has HIV and is developing AIDS. And on top of that, we do know this patient does use condoms consistently as well. So the best answer and the most likely cause of the thrush is that inhaled corticosteroid.
Excellent. Thank you, Paros. Once again, a challenging question, but great job to those of you who got it right. If you didn't, don't worry. It's a learning process, and hopefully you'll get it right on test day. Speaking of learning processes, while you're in medical school or you're studying for your exam, you're in dedicated or simply in basic sciences still, or even if you're studying for comm, we do have a coaching program that can help you along your journey. And as you can see there, we have a really high student satisfaction rating of a 4.9 out of 5. And that's because we have some wonderful tutors like Boris and Alec, who you met today, but also because we have so much experience when it comes to medical education. There are lots of tutoring companies out there before, but I don't think any of them have the experience that we have, because after all, we were created by the founders of USMLE-Rx, which of course was created by the authors of First Aid. So we've been in education for a very long time, and all those decades of experience came together to help create this coaching program, which has been so successful for all of our students. We help you identify your strengths and weaknesses. If you're studying for your boards, we will administer our own 160 question assessment, once again, something unique to our company. And then we'll help you create a personalized study plan, and we'll work with you on a one-on-one basis to really see how you think, how you learn, how you apply what you know. And our students regularly tell us, we wish we came to you earlier because it's saving us time and we're seeing progress at a faster rate. So if you're struggling, or if you are already doing well and want to do even better, if it's taking you too long to study, if you're if you're studying and you're not seeing the results that you want, or it's taking you too long to get to where you want to be, instead of telling yourself, okay, I'll try something different, or I'll go on Reddit, or I'll ask my friend what they did, reach out to us, schedule a free consultation so we can talk to you about the program and how it can benefit you. You can do that at rx-coach.com. Click on the free consultation tab and we can talk about the program. The reason why I say, avoid Reddit or friendly advice, sometimes it's great, but keep in mind that everybody's different. Everybody learns differently, everybody thinks differently, and everybody applies what they know differently. So even though you may find very good advice, that advice may not be applicable to you, and it could actually cause you to waste time or even regress. So once again, if you want to work with one of our amazing coaches, reach out to us at rx-coach.com. All right, so with that, let's go ahead and get into our third question of the evening. Once again, the answer choices are covered up, that is by design, and we will begin by reading the lead-in, which is the last sentence or the question itself. This patient's underlying condition also predisposes her to infections with which of the following organisms? I'll give all of you a few seconds here to let us know in the question box how many steps you believe this question will require. I see the responses coming in, so let's go ahead and read that vignette. A 23-year-old woman goes to her family physician with a 6-day history of dry, progressive cough, rusty-colored sputum, chills, subjective fever, and malaise. She states that she experienced similar symptoms in an episode 5 months ago and was treated with antibiotics. Her past medical history includes an allergic reaction to a blood transfusion. On physical examination, her temperature is 38.9 degrees Celsius or 102 degrees Fahrenheit, and her respiratory rate is 28 per minute. Breath sounds are decreased in the right lung field and crackles are heard on auscultation. A chest X-ray shows an infiltrate in the right lower lobe. This patient's underlying condition also predisposes her to infections with which of the following organisms? I want all of you to start thinking once again about the important clues in this vignette and the lead-in as I hand it off to Boris.
Thank you, Sean. So once again, a pretty nice long vignette there. So again, demographics, this is a 23-year-old woman. So that's going to start changing your differential versus if this was a 70-year-old patient. We're given some signs and symptoms. You know, it's always important to know the duration of those symptoms. Important clues like the color of sputum, as I mentioned before. We know that patient had something similar a few months ago. They give us some important past medical history and then some physical exam findings as well. All of those are going to be important in figuring out what's going on. Whenever you get chest imaging findings, things like that, always important to make note of that. So in the lead-in, this is asking us about, what is she predisposed to? So this underlying condition predisposes her to infections with which bug? So how many steps is this question? Well, one, I think we need to figure out what is this underlying condition they're speaking of. So that's one. Two, based off that, what does that predispose her to? What infections is she predisposed to based on that condition? So probably another two-step question here. So let's go ahead and take a look at those answer choices. And once again, we are going to start at the bottom and work our way to the top. Answer choice E, Strongyloides stercoralis. D, Neisseria meningitis. C, Mycobacterium tuberculosis. B, HIV. And A, Giardia lamblia. So once again, we are going to go ahead and open up that poll. Start trying to piece together those clues and select the answer choice that you think is the best answer. And we'll talk about it in just a few seconds.
All right, so we'll give all of you a few seconds here to respond and select the best answer. I saw a question in the question box about is RX Coach mainly for a dedicated period? And no, that's not necessarily true. We work with students during basic sciences to help them plan their studying, make schedules, learn the material, and exceed on their in-school exams so that they're a step ahead when they get into dedicated. But yes, we do work with students in basic sciences all throughout all phases of it, whether you're still in school, in class, or whether you're in dedicated. We also tutor for step 2, so keep that in mind. All right, see the responses are coming in. We'll give all of you a few more seconds. All right, let's take a look and see what you selected. And once again, 42% of you selected the same answer, and that answer was A, Giardia lamblia. Let's see if that's the correct answer. And it is, in fact, the correct answer. So great job, everybody. I'll hand it back off to Barbara.
Thank you, Sean. Great job, guys. So definitely a very good question here. So most importantly, we know that this patient has a few things. So fever, cough, and then some physical exam findings and x-ray findings that suggest a pneumonia, okay? So this patient's got pneumonia. Well, they also told us that this patient maybe had pneumonia 5 months ago, right? Similar symptoms. A 23-year-old woman, that's a little bit odd to be getting two types of two pneumonias in a short amount of time. So I think it's fair to start thinking about an immunodeficiency. You know, we don't know her childhood history, but I think it's fair to start considering that. So, what is the most common immunodeficiency? That is selective IgA deficiency, okay? Now, I think on the next slide, Sean has actually gone ahead and pulled up a table that talks about selective IgA deficiency. It's the most common primary immunodeficiency. The majority are asymptomatic. However, you can see airway and GI infections and anaphylaxis to IgA in blood products, okay? You can also see there in the findings that they have increased susceptibility to Giardia lamblia or giardiasis, okay? On the next slide as well, there's another table that talks about specifically IgA and what it does in just basic immunology. You can see there as well, in I think the fourth sentence of that row, that it's produced in the GI tract and protects against gut infections such as Giardia. So you can hopefully understand how if you have an IgA deficiency, how you'd be at risk for such gut infections, okay? So let's go back to our patient and take a quick look at that vignette again. So you can see now why they told us that this patient had an allergic reaction to a blood transfusion in the past. It's probably because that blood transfusion had IgA in it, and because she has an IgA deficiency, her body didn't recognize it or recognized it as foreign, and then had an allergic reaction. So this patient probably has that as well. So thus the best answer choice here is she is also predisposed to infections with Giardia lamblia, answer choice A. But let's talk about the other answer choices real quick as well. So answer choice E. An infection with this, you could see vomiting, diarrhea, lung symptoms as well, maybe a rash. But, really big risk factors that would put you at risk for an infection with E would be travel or steroid use, which we don't really have here. Answer choice D. Neisseria meningitis usually presents with fever as well, but more headache, neck stiffness, and risk factors that you may see with that would include living in close contact spaces like military barracks or college dorms, or having a splenectomy, and we don't really have those risk factors here. Answer choice C, tuberculosis. So you can also have fever, cough, coughing up blood, but risk factors for TB would include also living in an area like that as the previous answer choice, or also being in an area with high rates of tuberculosis or being immunocompromised, which we're not really getting those risk factors here as well. And then lastly, HIV. We aren't really given a lot of risk factors for this patient developing HIV, like intravenous drug use or risky sexual behavior. So probably not HIV. So the best answer choice in this case would be answer choice A.
Excellent. Thank you so much, Bars. Great job, everybody. We're doing well tonight. Let's go ahead and finish strong with our last question of the evening. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following is most likely to be seen on further examination of blood and or stool samples from this patient? I'll give all of you a few seconds here to think about how many steps this question will require. And we have a comment from a student, says, I have an RX coach and still in the basic sciences, helps a lot, exclamation mark. Well, thank you so much for the comment. I see the responses coming in. Let's go ahead and read that vignette. A 24-year-old man comes to the emergency department because of profuse bloody diarrhea and abdominal cramps for the past week. He also reports mucus in his stool, low-grade fevers, and a 5-pound or 2.27 kilogram weight loss. He recently traveled to Mexico, where he drank untreated water. Physical examination shows diffuse abdominal tenderness without rebound or guarding. The remainder of the physical examination and results of a complete blood count are unremarkable. A stool sample is sent for laboratory evaluation. Which of the following is most likely to be seen on further examination of blood and or stool samples from this patient. So as you start thinking about those important clues, I will hand it off to Paris.
Thank you, Sean. So once again, we are going to show you what we think are the important clues in this vignette and the lead-in. And hopefully by doing this with these 4 questions, you can kind of start to see what we think are important clues and what is not necessarily as important. It's important to be definitive with your highlighting and not highlight too much, but really highlight what's pertinent. So again, demographics, 24-year-old man, profuse bloody diarrhea for the past week. We have some travel history. We have some information about fevers and mucus, all going to be important in this question. And that's really all you kind of need to know for this question. So let's take a look at that lead-in. And it's asking us what's most likely to be seen on the exam of blood or stool. Okay, so how many steps is this question? 1, I think we need to figure out what the diagnosis is that this patient has. And then 2, based off that diagnosis, what could you maybe see on blood or stool examination? So I think another 2-step question here. So let's take a look at those answer choices and see what we're working with again. Answer choice E, trophozoites with ingested RBCs. D, tear-shaped trophozoites with 2 nuclei. C, RBCs containing schizonts. B, macrophages containing amastigotes. And A, acid-fast staining cysts. So once again, we are going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. This is our last question of the evening, so let's try to finish strong. Keep in mind that we do have a raffle at the end, and you must be present to win, so make sure you stick around because you might be our lucky winner. We also have a very special offer for all of you in attendance. For now, we'll give you a few more seconds here to select what you believe is the correct answer. Remember once again that the responses are completely anonymous, and just like on test day, there is no penalty here for guessing. All right. I see the responses coming in. I'll give you a few more seconds. All right. And let's see what you selected. And once again, 42% of you selected E, trophozoites with ingested RBCs. So let's take a look and see what the correct answer is. And the correct answer is once again E. It looks like 42 is our lucky number today. So let's go ahead and hand it off to Paris so we can explain it to you. For those of you asking, next week's topic is the reproductive system.
Great job, guys. Thank you, Sean. So let's talk about this case. So this is a patient who recently traveled to Mexico, drank untreated water, and now has bloody, mucousy diarrhea with some fevers and weight loss. So really the one thing that should be sticking out to you with mucus in the stool, bloody diarrhea, travel to Mexico is Entamoeba histolytica. Okay, that's transmitted via cysts in water. And actually on the next slide, Sean has actually gone ahead and pulled up a table looking at some of the GI protozoal infections. You can see there, looking at Entamoeba histolytica, bloody diarrhea. You can also have right upper quadrant pain, okay? And then when you look at Giardia, you see that it's more flatulent, more foul-smelling, fatty diarrhea that's non-bloody, okay? Versus Cryptosporidium, you know, if you're immunocompromised, it can lead to severe diarrhea, but in immunocompetent, it's more so just watery diarrhea. So knowing that, and also looking at the very bottom, you can see that Giardia kind of has those tear-shaped trophozoites with 2 nuclei, and also Entamoeba histolytica, you can see there that the pathologic finding would be trophozoites with engulfed red blood cells. And that's actually what they're pointing to with those red arrows in image C. Okay? Those are red blood cells that are engulfed. Okay? So let's go back to our vignette. Hopefully you can see now why trophozoites with ingested RBCs is a correct answer, because that's what you could see in sample from a patient with this infection. D, as mentioned, that would be more characteristic of Giardia, but again, that's more fatty, foul-smelling, and non-bloody, which we know our patient has bloody diarrhea and not necessarily fatty. Answer choice C, red blood cells containing schizonts. That's probably getting at an infection with Plasmodium species like malaria. This patient doesn't have recurrent, anemia, chills, flu-like symptoms, so that's unlikely. Answer choice B, macrophages with mastigotes. Remember I said there's a couple things you should think about when you have macrophages with engulfed bugs. One would be histoplasmosis. The other is leishmaniasis. Patients with leishmaniasis can have anemia, weight loss, ulcers, not really a diarrhea type picture. And then lastly, answer choice A, acid-fast staining cysts. That would be getting at cryptosporidium. As we mentioned, in an immunocompetent patient, that would more so be watery diarrhea, not what this patient has. So the best answer here is answer choice E. And we had a lot of two-step questions today, but you could tell that they were very in-depth and required a lot of knowledge. So hopefully you can see how picking up on those clues really can help point you in the right direction.